A very lovely sister held my hand and said, the only way we can treat you now really is to put you to sleep, which was awful because my first thought was my children. But I've got no alternative really, so I said to her, I love my children, can you tell them? And I think the fact that I was then out of it, but they had to have this horrible news every day. I mean, the first 2 or 3 nights I was frightened of going to bed because the first night I went to bed I was having recurring dreams that I dreamt while I was in the coma.
Some breathlessness, some cough, fatigue, muscle fatigue and limitation in what they can do, activities of daily living, ADLs, but also some report quite vivid dreams, memory loss of the whole admission. What we call higher executive function. The more prolonged the stay in hospital, the more severe the COVID, the requirement for intensive care or for high flow oxygen identifies a group of patients who are more likely to have persisting symptoms at 6 weeks and longer.
So to put someone on a ventilator, you need something that is reversible or treatable, which is one of the key determining factors of whether someone comes to intensive care and goes onto a breathing machine. In terms of whether the ventilator can do harm, yes it can. By mechanically ventilating people, we are very much changing the way that air goes in and out of the lungs and therefore in and out of the body. And there's been a multitude of papers over the years that look into the damage that a ventilator can cause.
So this is what you would expect a lung to look like, which was essentially normal, but essentially lots of black stuff, which is air. Now after about 7 to 10 days, this is the sort of at-risk period for someone with severe COVID. You can get a profound inflammatory response in the lung, and you can see that here. So all the nice black lung tissue is replaced by this, what we call ground glass area. This autonomous scarring process, we're not sure why it happens. There's a genetic predisposition for it, for sure, and it seems to affect elderly male people, which are the same demographic who are suffering severely from COVID pneumonia. So our concern is that if a patient develops this at 3 to 6 months, they may go on to behave like idiopathic pulmonary fibrosis. We don't know if that's going to happen at the moment. Data from SARS and from MERS would suggest that a small number of people that does happen to. And the trouble is with COVID, there's so many people who've been infected. So that even a small number of people going on to develop this represents a huge number of people.